Guests on the show today are from Henry Ford Jackson Rehab Services, speech language pathologist Mallory Crabtree and Kristen Beneteau. Welcome to the show.
Thank you.
Great to have you here.
Happy to be here.
Speech pathologist. What's the difference between a pathologist and a therapist? So I think of a pathologist, it's like, like a medical examiner.
Yeah. So they're basically interchangeable. Speech pathologist is more like the medical name for it, but a lot of people call us speech therapists. So
great.
that's kind of what we're known as.
And you're both speech language pathologists.
Yes.
So having language in there, what does that mean? Speech language versus speech pathologist.
Therapist.
Yeah. So it's our title does not encompass all that we do. So we get that a lot with when we go and see people, that they say, well, I'm talking just fine. But there's actually a bunch of different things that our job title encompasses. One of those being speech, the way we produce sounds, and another one being language, the way we form sentences. But that's just kind of the tip of the iceberg with what all we can bring to the table.
So what types of speech issues do you guys deal with?
So we work with people who have difficulty producing or understanding words and sentences. We work with people who have trouble swallowing, who have voice issues, stuttering. We help people with cognition, memory.
And someone like President Biden, we all saw last week, stutter. And it seems like under pressure, it can get worse. And that's a typical situation for someone who stutters.
Yeah.
And is there a cause of, for instance, the stutter, when you have a patient that has a stutter, do you have to do a deep dive into, other issues that might contribute to the speech issue?
Do you want to touch on the stuttering side
Sure.
of things?
Well, it kind of depends on what's going on. With a stutter, usually it's neurologically related. So you can kind of get an idea of what's going on with the patient based on why they're being referred. So if they're being referred for this, you think it might be caused by this, so to say. But all of our speech concerns that we address usually have different causes.
Yep, and the stress is a really big part when it comes to stuttering, and it's something that can affect someone their entire life. So we'll work with young kids that have stuttering going on. It can also happen after strokes, which I work in the adult setting, so I see more of that than I do with the pediatrics like Mallory does.
We see parents get nervous. They think, oh, my child isn't speaking yet. They're not talking. We should be hearing all kinds of things, and it's just not. Different, every kid is different. When does a parent get concerned and take a concern to you about the speech of their child, a toddler, for example?
So I would just encourage parents to just be aware of the milestones. You can ask your pediatrician about the speech and language milestones that they should be meeting. You can also look on ASHA. That is our organization for speech pathology, and they have a lot of different milestones that you can look at. And if your child's not meeting those milestones, I would talk to your pediatrician about getting help, bringing them in for an evaluation.
I have grandkids, and one of them, when he was just starting to talk, actually both of them, they talk with like an accent. And is it because it's developing and they're gonna grow out of it?
What do you mean by accent?
Burger instead of burger.
Yeah. So that would actually fall under the domain of articulation. So that's like the way they're pronouncing words. They might just not know how to move their mouth the right way to get all of those sounds. So yes, speech therapists could definitely help with that. Some sound errors are developmentally appropriate. It just kind of depends on where they're at in their age and what sounds are appropriate at that time. So.
Sometimes I think we thought, oh, he's doing it on purpose to bug us.
Yeah, and the R is actually a very tricky sound for kids to hit, and a lot of kids have a hard time with it. It's a very difficult sound to make.
Yes, it is.
So you have to assess a speech disorder and discern that it is a disorder and not just something else. How do you do that?
Well, it differs between outpatient and inpatient, so I'll
Mhm.
kind of talk about the outpatient side of things because that's where I work. In outpatient, we usually do some kind of standardized assessment based on what's going on with the patient, determine, what are their strengths and weaknesses, what can we help with, what might be the cause that we kind of already talked about, and go from there.
Are there things in a session that are typical that you would do as you assess someone?
In every assessment session, I like to probe them and see what they are able to do, see what what might help them in sessions, what kind of strategies might be useful for them during our treatment sessions.
So you have inpatients and outpatients.
Yeah.
So in really typically a medical setting, an inpatient thing is a more serious thing.
Not necessarily. When we're talking about inpatients, and specifically we're talking about the hospital setting, we're seeing people right after their injury, whether that be a stroke or a car accident or a brain injury of some kind. And it's most of what I do, I work in the hospital setting, is I'm evaluating patients. Most of what I do every day is I'm doing assessments and essentially determining if there's an issue and if they need additional speech therapy. A lot of times I'll refer people then out to people like Mallory in an outpatient setting where they'll get more intensive therapy for a longer period of time. But most of what I do in the hospital is regarding swallowing and swallowing disorders. So it can be caused from a variety of things, from cancer to having a stroke. And then I assess them and determine what's a safe thing for them to be eating or drinking. And kind of going from there. So our sessions look a lot different than they do for Mallory at outpatient.
And you work with pediatric patients.
Yes, I work with pediatric patients and adult patients.
At what age do you start?
As young as they come.
As soon as they can talk,
Yeah,
right?
or sooner, yeah. I also see pediatric patients for feeding, so a lot of times I'll work with babies who are having difficulty with feeding, so that's another thing that we can do. It falls under our scope of practice. Yep.
Do you have to bring in the dentist at any point, that maybe something with their teeth, how their teeth are growing in?
Sometimes yes, yeah. If there's any kind of abnormality and it seems to be impacting either their speech or their feeding, then definitely we would refer that they go see a dentist or get in touch with their dentist if they're already seeing one and see what can be done.
How many different issues can someone have that you would see?
There's a lot.
So a surgery or an illness could cause something.
Yeah, certainly. An injury, something developmental.
There could be psychological, some mental issues that are causing a physical.
Yes.
That can happen too.
Is that hard to discern that?
A lot of times when we get people coming in, a lot of times there's already a cause that a doctor or a physician has determined, which kind of helps guide our treatment. So if it's someone that, for example, is more of a psychological issue versus an injury, the way that we do treatment for those people is different. And so we don't do as much with determining why something is the way it is. We say, this is what the issues they're having, here's how we can help address them.
Do you need the family to be part of this? Is your therapy or your work with just the patient, or do you need family members to be part of whatever the therapy might be?
It's usually helpful. Yeah, it's really helpful to have the support from the family, and from a pediatric perspective, having that family support to help that kiddo out can definitely make a huge difference. If they're taking the strategies that I'm doing in the clinic and doing those at home with their child, we're going to see progress faster.
Do you have people that come in and say, my wife mumbles, I can't hear her. She's,
Yeah, we get those too.
So it might not be someone's speech issues, it could be someone else's hearing issues.
That could exacerbate the issue. So there may be an underlying speech issue, and with a hearing impairment on top of that can make it even harder. But it's still impacting that person's quality of life, and it's still important to treat the issue.
There are people that have hearing issues that can't hear themselves talk, and their speech is, you can tell that they're struggling to form sounds.
Yeah.
That's another case that
Yeah,
you would see?
definitely. In that kind of situation, it's important to teach them how to move their mouth the right way and focus on the things that they can control and they can see and do.
And you're able to find the problem, get them into the appropriate therapy, and have a successful conclusion. That's got to be really
Yeah.
satisfying.
Yeah,
as
it's
a-
very rewarding. It really is.
So for you, Mallory, what would you say is that you've seen as far as your greatest, excuse me, greatest accomplishment or satisfying outcome with the patient's success?
Yeah, so I was seeing a child who was getting tube feedings because he could not orally feed. And over the course of about 6 months of treatment, he was able to take food orally again and got his feeding tube removed. So that was extremely rewarding.
And it took 6 months with an infant, and you can't communicate.
Right? Yeah.
That I can see how that could be very satisfying.
Yeah, very rewarding.
But
Very
frustrating for you. I mean, 6 months.
Oh, it's all worth it. You see the small steps of progress towards the big goal every day.
Kristen, do you have a situation that you can think of like that?
Yeah, I mean, I think, a lot of people don't realize that we do so much with swallowing, and until you have an issue with it, it's something you don't really think about. But it's a huge quality of life issue, and food is surrounded by so many social events for us, like holidays. So when we get people that they have a lot of trouble swallowing, their quality of life is really impacted. And so anytime that we can help people problem solve that and get them on any kind of diet to be successful, or like Mallory, when they get their feeding tube removed, it feels great, and it feels like we share our success with our patients and their families.
Nice. What do you mean by diet? What are there some certain foods or things people that are eating that are causing speech issues?
It can, yeah. So when we talk about diets, we're not talking about that maybe they need to cut sugar out or they need to cut salt
Okay.
out. What we talk about is the consistencies of the food. So in some situations, maybe thin liquids like what you're drinking now might be more difficult and cause them a lot more problems. We might look at thickening it if we have to, or maybe they can't chew up the food as much anymore, and so we look at softening the food. So we look at the consistencies, and so when we talk diets, that's more what we're referring to.
Not eating caramel apples.
Right, right, yes.
For getting back to stuttering, people that have an acquaintance that stutters, how should you interact with that person to either help them or make them more comfortable and not create more of a stress?
It's important to just let them talk. Talk to them like you would anyone else. Don't treat them any differently. Give them the time and space to be able to get through what they're trying to say, especially if they're getting stuck. Just make them feel comfortable.
Don't try to fill in their answers.
Right.
Yeah.
Yeah,
Right.
just let them speak.
Give them time.
Do people need a medical referral to see you guys?
Yep, a physician, a doctor could refer us.
Yep.
Great. Well, great to have you with us today. And
Yeah, it's great to be
great to
here.
have you
for
on,
having
yeah. Nice to have you on the Henry Ford team here in Jackson.
Yeah, happy to be here.
Speech language pathologists with Henry Ford Jackson Rehab Services, Mallory Crabtree and Kristen Beneteau.